Lord knows that I want these tooth-borne expanders to work just as much as anyone else. I'm not a stakeholder in MSE. Like, I don't own stock in MSE. You know what I mean? Like, I was the first one to do the tooth-borne expander. Like, this is my old tooth-borne expander. I did it. In my opinion, there may be some bone change happening as a result of a DNA or similar appliance like this. If you are careful enough with it and you wear it consistently and you turn slowly enough and the appliance is built properly so that it's putting stress in the right places, I think it's feasible that there could be some bona fide skeletal changes happening. My issue with DNA and with other tooth-borne appliances is that it's an inherently inferior technology and approach. Why would we want to achieve stretching of the mid-palatal suture by using the teeth as levers when we could use the bone itself as a lever? Think about an MSE and how much it struggles to split the suture, even using 4 1 centimeter screws screwed into the maxilla, and it still struggles to split the suture and to get sutural changes. Think about Casey Lee, who himself admits, even with the surgical assist, even with the ease surgical assist, and with his appliance that's parallel to the force vector, that has no screw tipping, no screw drag, it's pure force going into splitting the maxilla. Even he says he has cases that fail. It's a small amount, but they're out there, a small handful. How are you going to tell me that when we have skeletal expanders with surgical assist screwed into the maxilla and they're still failing to change the maxilla, you're telling me that something pushing on the teeth is going to be comparable in terms of skeletal changes that you're going to get with it when it's using the teeth as levers? Where we know for a fact when you push into teeth, they change. That's how orthodontics works. You put pressure on teeth, they move through the alveolar bone. So the DNA appliance in any tooth-borne expander is trying to stretch the suture by mostly pushing on teeth. Yes, to some degree it pushes on the roof of the mouth, but what it's really pushing on, and you'll know as soon as you put one in because you'll feel it. It's pushing on the teeth. And so what's more likely to happen with a DNA is you're putting pressure on the teeth. The teeth are going to tip. The teeth are going to suffer periodontal damage. You might get some skeletal expansion, but that's going to be an afterthought as compared to the dental tipping and the dental wear and tear that you're going to absorb along the way.
Yeah, that makes sense.
So in other words, in summary, with a DNA, you can get some results, but they're very small and the collateral damage is tremendous. The ratio of damage to results is extremely poor in relation to a skeletal expander.
Yeah, I totally believe that. But I'm wondering, what if they're not trying to split the suture necessarily, but simply, for example, pushing on the alveolar bone to get it to flatten out? Like if you have a vaulted palate, which I think most people who have narrow maxillas probably do, right? So is it really necessary to split the suture itself?
So if you don't split the suture, you're not going to get any change in the nasal volume, first of all. Moving the alveolar bone does nothing for the nose. It gives you tongue space, and it helps your oral airway and your pharyngeal airway, but it's not changing the nasal airway. And, Dr. Casey Lee himself, who's all the rave right now, he himself says that the nasal airway is absolutely the most important component of treating sleep apnea.
Yeah.
So he says the nose is the priority, and that's why his ease expander, optimizes nasal expansion as opposed to oral expansion. And so that would be the first thing. The second thing, with regard to, as you said, bending the alveolar bone, on paper, you might think that's what's happening, but what's actually what the patient is experiencing because he's experiencing a piece of plastic pushing into the gums around his teeth, and it's extraordinarily painful, causes gum recession, and does damage to the teeth.
Mm-hmm.
So where are you putting the force on the alveolar bone? You're putting that force essentially right directly onto the teeth.
Yeah.
Right? And so the teeth are going to suffer.
Mm-hmm.
Do I think that if you can get oral volume that way, that it would be beneficial? Yes, but at what cost?
Yeah.
Right? And then also you're just, at that point, you're tipping maxillary, even if you're just tipping the bone, you're tipping the teeth, and so the teeth end up flared out. And so then what do? You have to bend them back in to reestablish occlusion. Yeah. And so you're round tripping.
Mm-hmm.
And then the final point is, why would you do that? Why would you even want to do that when there's these other options available that just avoid all of these problems?
Yeah. I think it's
like it's not like we don't have other options.
It just seems, MSC and E's, they just seem like way more invasive, but not necessarily. Besides asymmetry.
This is the more invasive fallacy.
Yeah.
This is the fallacy, because people fallaciously believe that skeletal expanders are more invasive than tooth-borne expanders, but that's actually the inverse of the truth. The truth is that tooth-borne expanders are far more invasive because they cause tooth problems.
Yeah.
And tooth problems are a nightmare for the rest of your life. If you start down the road of periodontal damage caused by excessive orthodontic force, especially in the outward direction, side to side is okay, but pushing outward is extremely destructive to the teeth. That's a one-way path.
Yeah.
Teeth are like plants, where once they start dying, it's very hard to recover them, and even if you do recover them, they're always just going to be a shell of what they could have been had they been allowed to take a natural, healthy path.
Yeah. I have a tooth issue.
That's why the whole field of periodontistry exists, to deal with these types of problems. These are horrible, horrible problems to have.
Yeah.